Hi there, and welcome to The Checkup. I'm Caroline Hudson, Modern Healthcare's finance reporter. Thank you guys so much for tuning in. The COVID-19 pandemic brought a devastating blow to the healthcare industry. 2.5 years in, it's still having ripple effects. Staffing shortages remain, meaning health systems must pay higher prices to secure workers. Supply costs are elevated, and some service lines have not returned to pre-pandemic levels. As a result, many hospitals were operating in the red in the first half of 2022, with executives concerned about the financial ramifications when federal relief funding gives out. Joining us today to talk about these topics is Ed Lovern, President and CEO of Ascension St. Agnes in Baltimore. He joined Ascension St. Agnes in July 2020, bringing more than 25 years of experience in healthcare executive roles. Prior to Ascension, Mr. Lovern was Chief Operating Officer at Piedmont Atlanta Hospital, part of the integrated system Piedmont Healthcare. Mr. Lovern was also the Washington, D.C. Bureau Chief for Modern Healthcare magazine. Thank you so much for joining us today.
Caroline, it's great to be here.
Well, I think just to start off real general for our audience today to set the stage, can you talk a little bit about, at this point in 2022, what kind of effect is COVID-19 having on operations right now for you? What are you seeing currently?
Well, we don't think about it as much, certainly, as we have in the past, but it's still with us. And we ended up with about 10 to 15 patients in the hospital a day still who are COVID positive. And while our staff is very used to taking care of these patients and the severity is different, it still requires all the gowning up, all the PPE, a different level of care than you're dealing with when you have a patient without COVID. I think the other big impact is that we still have 10 to 15 of our associates, our employees, who are on furlough every day. So at a time when the staffing situation is very challenging, that exacerbates it and makes it even more challenging. We wear masks all the time. It's interesting. I go to a lot of places outside the hospital where I don't wear a mask, but in the hospital, we have our masks on. So it's always with us. And I think that there is certainly, you mentioned some of the ways that we are still recovering from the pandemic. And I think there's more than that. I think there's just so many ways that we will always be changed as a result of the pandemic, and we are still adjusting to that in many different ways that we have our associates and our employees, and the way that we are trying to navigate the market. So it's still significant, but like I said, it's not in the front of our mind the way it used to be.
Makes sense. Well, I want to zero in specifically on staffing shortages. You mentioned this just a minute ago, but what does that look like for you guys at this point?
It makes everything more challenging because it's so global. It makes obviously taking care of patients challenging, growing services. There's the demand for services that we sometimes can't get the staffing for. We're in Baltimore, a large urban city. We are dealing with a lot of emergency department diversion by all of the big providers. And it's global. It impacts all of us. I think we're all competing to try to get employees in different ways, but there's just such a limited amount. And I've had the benefit of getting to serve as the chair of the Maryland Hospital Association's task force on the future of the healthcare workforce, and have had a chance to see other hospitals and how they're dealing with it, and talk to other experts, and try to think through this. And as you can imagine, it's a very complex issue for us to try to figure out. I'm a huge fan of healthcare careers. I think it's a wonderfully rewarding area to go into. It has a lot of stability. It's a mission type of calling that people go into to get into healthcare. So I really encourage people to think about these careers. And I think that going forward, we're going to have to really figure out different ways to get people to enter the healthcare workforce. One of the things that's important to me as a hospital CEO is to make sure that our associates feel like while they're here, they're living their best life possible. And so I know every CEO probably thinks that, and I think it because that's the kind of life I want to have when I'm working here, and I think it's possible. So I really want to set up a workplace where people feel excited to go to work, where they feel protected, where they feel like they're paid the right amount of money, where they're supported, where they're doing meaningful work. And that's increasingly challenging as I think people's attitude towards work changes. And we've got a number of strategies and ways to try to address that. Thinking back to the MHA work, the Maryland Hospital Association work, we first have focused a lot on trying to expand the pipeline of getting more people into healthcare fields. And there's a lot of different ways to do that. One of the things we are aware of doing more of is really collaborating with not-for-profit organizations, closer relationships with community colleges, with universities, with not-for-profits that train employees, because we really want to be aware of where we can pull from. Another aspect of this is making sure that we are reducing any barriers to people getting their healthcare education. We know that there's probably about a 20% dropout rate for nursing students. And there's an opportunity to have a lot more wraparound services to make sure that if we can reduce that dropout rate, for instance, by half, that's a lot more people coming into the workforce. So we recently have had a program to take some of our employees and put them through training to get their LPN certification. And one of the aspects of that program is to make sure that we're paying them for the time that they study. I think we've got to really think about all aspects of how to make people successful when they go back to get their education, so they can get back into the workforce.
Right, makes sense. Well, how would you say, just in general, the shortages compare to 2020 and 2021, if you can even compare it to that?
I think 2022 has obviously been the worst, and we really start to see it hit in late 21. It was driven up, I think, by the phenomenon of having a lot of agency labor demanded by different parts of the country that were experiencing spikes in COVID. And I think that fed on people's, the burnout factor that they had gone through, the attitude that they needed to make money while there's an opportunity to make money, and it's really changed the perspective. And, I think it's important to say that I completely respect the way workers have gone about that. I think it's if I had the same incentives, I think I'd consider the same opportunities. And you have to think of how to support your family. But it's created a different dynamic between employers and associates. And I think we've got to work harder to make sure that we are rethinking that relationship. And, a place like Ascension has always done a great job at making sure that we have employee assistance programs and ways that we're looking out for employees' well-being. But I think in the future, it's got to change and be even more intense. And we're talking with some local not-for-profits and local service agencies to be able to offer those services in the hospital. I think a lot of things have gone online, and that's great. It makes it convenient and accessible, but really thinking about how people have that personal touch so that when they have a problem, any sort of problem, whether it's financial or emotional or career oriented, that they've got a place to go to be able to talk through that. One of the things that people, I think, forget or don't realize about hospitals is that we are about 80% women, and that results in a high number of single mothers and people who are dealing with a whole lot of stress in their lives. And we know now with the pandemic, as we go further into it, the impact on people's mental health, especially children's mental health, is becoming a factor that is influencing what our workforce has to deal with. So if we're going to be successful in getting people to have a relationship with their employer going forward, we're going to have to figure out how we play a bigger role and provide different services than we've ever provided before. And to me, that's exciting to be thinking about that. I think it's a great opportunity, and it doesn't have to be a competitive opportunity. Again, with my work on the Maryland Hospital Association's task force, we were very collaborative in thinking about that. And I think there's ways that hospitals can work together to offer those services, especially when you're in a climate where we're all not-for-profit hospitals and we all have a common, we're serving a common mission in the sense that we're trying to take care of people who need healthcare. But we have to figure out a different way to do it. We're at an inflection point where I think if we don't, we're really going to have problems going forward in having a sustainable staffing solution.
Yeah, for sure. Well, switching gears a little bit from staffing, can you describe a little bit about what you're seeing as far as financial performance? Of course, in general, most health systems are really hurting in 2022 for obvious reasons. But what are you seeing, and where are some areas that maybe could use improvement, do you think?
Well, you talked about it at the intro, and we are seeing the combination of increasing labor costs through this year. Our volumes still haven't caught up to what they were pre-pandemic. And obviously there are other costs I mentioned, things like PPE and other adjustments that we've had to make as a result of the pandemic. So in Maryland, we're fortunate in that we have a unique payment system that really results in a lot more stabilization in the way that hospitals are paid, and that's helped us stay close to about a break-even performance. But throughout the country and throughout Ascension, there's challenges that hospitals are having. All the big systems are having challenges in figuring out how to make this new model work. And like I said, I don't know that the old system is going to work the same way. In the short term, we have to do all the things that we've always done of figuring out how to reduce costs by reducing our supply costs and any other expenses like that. I mean, we are rethinking how to be more productive. We look for opportunities to grow. We are looking for opportunities to improve rates, anything that we can do to make the bottom line work out. But going forward, I think we're going to have to refigure what it is how we do it and what the model of a successful hospital is. I know one of the aspects is moving to more value-based care, but that's certainly not a quick fix. I think as we get into it and hospitals begin to experiment with value-based care programs, we learn more and more that it really is a very long-term solution, and with aspects and problems that we're just running into that is going to take more than just the hospital industry to figure out. So I think there are a lot of unanswered questions of what comes next in the next couple of years.
Right. Well, I am curious, what are you watching for when the public health emergency, when that lifts, and also when some of the federal relief funding runs out? What are your expectations for when that does happen?
There's so much that is part of what that package has been for hospitals, and I think that a lot of changes were made in order to help hospitals be more innovative and do things that would get care to people. One of the biggest aspects of that has been telemedicine. And of course, many hospitals saw an immediate jump in telemedicine and televisits as a way to provide care when people couldn't come in. And for us, it stayed at about 8 to 10% of our visits. And it's a combination of, it serves people who prefer that type of access and people who don't have, who for coming into the hospital or coming into a doctor's office is a real problem. We hope that there is pay equity, in the way that we're reimbursed for televisits going forward. that will continue to have flexibility with the way that licensure is granted. And we know too that the redetermination efforts around some of the big Medicaid programs, it has to be an aspect that people are considering really more the impact that it's going to have on individuals. Because I think we've, if anything's been a positive with this, we tend to see more healthcare coverage, I think probably through the pandemic, through some of these flexibilities and extensions that have been given. And I hope we're very careful with how those are rolled back, because it'll have an impact on public health, and it will have an impact on hospitals. And at this point, there's just not much margin for us to be able to look to have a cushion to adjust for things like that. So again, this is a tough time for us, and we're running out of things that are the cushions, or the things that we could rely on when there was a business downturn. And I think throughout the country, we're seeing that. Again, in Maryland, there is a little bit more of a stability that's driven by the Maryland model and our waiver that we have with Medicare. But I think it's going to be a big challenge.
Sure. Well, you mentioned operating margin. Do you have any idea what that might look like in 2023?
Yeah, I mean, I hope it's enough for us to be able to break even and be able to put money into capital expenses and the other things that we rely on. I think we will see it bounce back across the country. I think there's been a big push towards making the kinds of adjustments we have to make in order to have a better bottom line. But I think it comes at a cost. I think that we end up, doing away with programs that were more experimental and things that were designed, in some cases, things designed to serve the community. I think if you look across the country right now at what's happening, people are paring back their inpatient services. In some cases, their maternal child health services, the things that they had in place for community health. They had to. I mean, those were the things that probably that didn't have a financial return. And that's unfortunately what people really have to look towards now is how they make a financial return. So 2023 might be better from a bottom line standpoint, but then I think we're starting from a step further back on some of the programs that we know are important going forward. So I think there's more to figure out to this than just reducing costs and trying to whittle away at supply expenses.
Right. Makes sense. Well, I think we'll have to wrap up here, but again, just want to say thank you so much for taking some time out to answer some of these questions. I really appreciate it.
I really enjoyed it, Caroline. Thank you so much.
Thank you. And thank you all for tuning in to The Checkup.